All right, thank you, Britton. Well, what happens when eating healthy goes too far? UAB nutritionist Dr. Beth Kitchen joins us to explain. So we're talking about a disorder, which is not really an eating disorder, right?
Right, exactly,
Okay.
Mike. Yeah, we sort of refer to it as an eating disorder, but it's not an official eating disorder. It's not in what we call the Diagnostic and Statistical Manual for Mental Disorders.
Possibly
the
a
DSM.
behavioral disorder, maybe?
But it's a lot of people think it's more of an obsessive compulsive disorder. Excuse me, and also that eventually it may be in the DSM, that manual. So, but this is something that was, we call it orthorexia, and the term was coined back in the 90s. And it was used to describe excessive healthy eating. Now, all of us know somebody who's a little fanatical about their diet. We're not talking about those folks, but we're talking about people who really plan their whole lives around healthy eating. They will never eat anything that's even a little unhealthy, and it kind of rules their lives. These are not folks that are trying to be too thin. They're not underweight. They're not purging, like vomiting and bulimia. So it doesn't fall into anorexia or bulimia. It's this excessive obsession with health.
Okay, so it can lead to possible nutritional deficiencies?
Right. A lot of, when I talk about this with my students, they often say to me, "Well, is that really that bad?
Right.
Well, you know, is that really that bad?" Okay, so they're a little excessive, but it could lead to nutritional deficiencies if someone is cutting out a whole category of foods, like they don't eat any carbs, they don't eat any fat. But the other thing, Mike, is that it can cause a lot of social isolation because it affects how you interact. Think about all of our social situations where we eat.
Right.
And so these are folks that are always bringing their own food or only eating specific things or they don't eat at all. And so they become very obsessive about it.
Nobody wants to invite this person to a barbecue joint.
They're not really all that fun to be around.
Right.
Yeah, exactly.
Okay, so maybe you're out there, you're saying, well, I don't think I'm orthorexia.
Right.
You've got some questions that you,
Sure.
sort of a quiz.
Right.
Okay.
Right. And this is not the official quiz because we don't really have a way of diagnosing it, but these are some questions that if you find yourself thinking like this, you might be going a little too far.
Okay.
And the first one is, do you wish you spent less time thinking about food and more time enjoying life? So this is where, again, your whole life revolves around food. Do you feel more in control when you eat a strict and correct diet? When you eat something you don't think of as healthy, do you feel guilty?
Okay, I'm going to have to answer yes to that.
Oh, okay, you're not too bad. You text me when you do that. Do you spend a lot of time reading articles about what foods are unhealthy for you?
I'm guilty.
And
now,
then,
wait a minute. I've got two of the.
Okay, but
I'm 2 for 2 so far.
Okay, well, you're a little bit more.
All right.
Do you think of yourself as a nutrition role model for others and wonder how people could eat the way they do?
Shame on you
So
people.
it's a little bit of this moral superiority of I eat so much better than you do. How could you eat that?
Okay,
Yes.
so if you answered
So
yes
if
to
you
basically
answered
all
yes to
those,
quite a few
what
of
should,
those,
what should you do?
You might want to start thinking about maybe seeing a therapist, talk to your doctor about possibly seeing a psychologist or a counselor to maybe say, do I need to back off of this obsession with healthy eating? Not everything we eat has to be healthy. We can have that piece of birthday cake. You know, when Rocket Man brings us the donuts, we all indulge in those. We can't not eat those. So.
Dr. Beth K., as we always say, everything in moderation. Thank you so much.
That's right. Thanks a lot, Mike.
JJ's up next.